Hello, I'm Ashley Cole and I'm the Center Director here at the Surgery Center. Just want to talk to you today about the procedures that we do here on a daily basis. Two of our procedures that we offer here that are considered anesthesia procedures where you do have an IV are discograms and radiofrequency ablations. When you're having sedation with your procedure, you are brought into the pre-op area where the sedation nurse then asks you some questions and also starts your IV. Some important things to remember when you are receiving sedation with your procedure is the fact that you cannot eat or drink anything for 8 hours prior to coming to the surgery center. Also, you must have a driver because you cannot drive within 24 hours of receiving sedation. A common question we have about discograms is if the procedure is actually going to help treat their pain. And this procedure is tailored more to diagnose or find out what's causing your back pain, so it does not treat your back pain. There's two parts to the procedure itself. The first part is at the surgery center when you actually have the dye or contrast injected into your back, and then you follow up with a CAT scan where they do imaging of the dye that's in your back. These are put together to help the physician better come up with a treatment plan for you. After your discogram, you can expect to have some increased pain for a few days. That is normal after this procedure. We've done this thousands of times, and I think the best thing that we've found to help you once you are home is to apply ice at the procedure site for the first 24 hours. Take it easy, just try to stay home, relax. You can take your normal pain medications. If you have ibuprofen, that would help as well. After 24 hours, you can switch to heat if you need to, if that does work better for you. After you have medial branch blocks, a common procedure that is ordered is the radiofrequency ablation, which is more of a long-term pain relief option. It's where we actually heat up the nerve and provide pain relief anywhere from about 6 months to a year. When you're having a radiofrequency ablation, you will receive IV sedation. Once you are in the procedure room, it typically takes anywhere from 5 to 10 minutes to actually have the procedure completed.
So one of the procedures we do called radiofrequency ablation is where we send radiofrequency pulse waves to the nerve that supplies the joint. Now, one thing about this nerve, it's just a sensory nerve, so there's no motor function to it. So it's not a nerve that innervates your leg or your muscles or anything like that. It just supplies the joint in the back. We'll send radiofrequency pulse waves to that nerve, and what it does is it decreases the pain transmission. So it's kind of like looking at a television set that is out of focus. So the pain can't propagate along that nerve. Therefore, your joints in your back feel much better. Now, the nerve isn't killed. We don't kill the nerve. We don't cut the nerve. We stun the nerve. And this procedure generally lasts about 6 months to a year, and then we can repeat it.
Afterwards, you're taken into the post-op area where we get your blood pressure again, go over all your discharge instructions, and make sure that you're feeling good and taken care of before we send you home. With the radiofrequency ablation, you can be a little sore at the procedure site for the first day or two. You can apply ice to the site as well and then heat after 24 hours. You can resume your normal pain medications and take anything additional for pain such as ibuprofen or Advil. After the procedure, you can't expect to receive a call from one of our nurses here at the surgery center. We do care about our patients. We want to make sure everyone's comfortable, getting good pain relief, and everything's going appropriately.